Okay, everybody ready? So because I sneaked in quite on short notice, I heard that nobody is prepared to introduce me, so I just introduce myself quickly. I work together with Claudia in the EU office of the Forschungszentrum Jülich. Before that, I worked in research as well. I studied in Graz in Austria, theoretical linguistics, did my PhD in Munich at the Ludwig Maximilians University Munich. And after my PhD, I changed into science management and worked in a company which was supporting and consulting on EU research funding. After that, I worked at the Technical University of Munich as EU research officer and supported the researchers and scientists there to get EU funding. And now I'm in Jülich for a little bit over a year and try my best to support the researchers there to get EU research funding. Actually that's my part tonight almost. What funding opportunities are there on EU level? So we heard already about the background, how EU research policy is made, how decisions are made, what directions or what focus areas will be funded. And now we try to dive a little bit deeper and see what does it mean really for funding for you, where you can apply with your research ideas. You have already seen there is a load of funding opportunities, funding instruments, so I focus on those instruments which are either interesting for you because of your scientific background or are interesting for you because you are in the early stage of your career, so you're all PhD or early postdocs as far as I know. So if you stay in academia, there are special instruments which really can support your research career, and I will focus on that. And if you have any questions, just don't worry, interrupt me and we can discuss it further. That's my agenda. So we start with the funding landscape again. So funding on research and innovation on EU level. We go a little bit deeper into Horizon 2020 and the structure and the focus areas there. Then we will have a look at the thematic areas, so the thematic calls, mainly in the area of health. Then some notes on the rules of participation. I will not go into that too deep or too much because this is really depending on the funding instrument, and you will get support and consulting there if you really apply for it. Then we will spend a little time on career supporting measures on EU level. And we have already heard like open science, open access. Those are so-called cross-cutting topics. So there are special topics which are relevant to each funding instrument, to each call, because they are really high on the priority list of the EU or the EC, and which you will find in each call or topic, no matter if it's a thematic health call or it's a research career support measure. And then last but not least, of course, where do you get support? So we are obviously supporting researchers at the Forschungszentrum Jülich. We cannot support all of you, but there are, in each country, at each institution, there are contact points, we have already heard about it, where you can get support if you thinking about applying for EU research funding. So we start with, again, Horizon 2020. Now you know that is the funding instrument or framework program for EU funding. So this is the main structure, a little bit more detailed than we have seen before. We have 3 pillars: excellent science, industrial leadership, and societal challenges. Those are called obviously after the priorities of the EU on higher level and especially for research. So the EU wants to support excellent science. The EU wants to close the gap between research and innovation and market and industrial application. So that's why we have a pillar here, industrial leadership, where research and industry should work together on specific technologies or topics. And we have the societal challenges, so the main challenges to be tackled, addressed in the EU or worldwide, where research plays a key role in tackling or addressing those challenges. We have already heard there are those horizontal themes, topics, issues, how you want to call it. One is widening participation and spreading excellence. That is really to support the European research area to include less innovative countries, so to say, so countries which are not that good yet in research or innovation, at least when it comes to EU funding. We will come to that later again. Then there is a horizontal line which is called science with and for society. So science should not only work for itself or do research for itself. Of course, it should account for the needs of society. And it's really important to also include society in research. And there are those two which are not that interesting for you as well, because those are really different things and not really direct funding instruments, so to say. So let's start with excellent science. This is more or less the bottom-up part of Horizon 2020. So you will find there the funding instruments under the European Research Council, the ERC. You probably heard already about it. This is the most prestigious grant you can get on EU level. I will talk about that later in more detail. Then we have the Marie Skłodowska-Curie actions. Those are really addressed towards mobility in the EU, so mobility of researchers in the EU, networks of training measures in the EU and beyond. Another funding instrument or topic is Future and Emerging Technologies. The acronym is FET. Obviously, the FET flagships, as the Human Brain Project, are integrated in those instruments and in those schemes. And there is also funding available for big research infrastructures. So, of course, we have already heard the Arctic mission. So, you need, of course, special research ships, for example, for doing that, to do research in the Arctic. So, such things are funded under the research infrastructure scheme. The second pillar is the industrial leadership pillar. So, the key word here, you will hear it a lot of times if you go through EU funding, is like leadership in enabling industrial technologies or key enabling technologies. You will hear that as well. This is mainly the part of ICT, so information and communication technology, obviously, nanotechnologies, advanced materials, biotechnology, advanced manufacturing and processing, and also space. And from those topics, you already see that those are the topics where really industry and research have to come together and bring the research from the lab into market. So that's at least the vision of the EC. The third pillar is the societal challenges pillar. So here are the major topics areas defined where the EU sees the challenges which have to be addressed, have to be changed, have to be tackled somehow. The major societal challenges identified by the EC for Horizon 2020 are those. So first of all, health, which is the most interesting for you, obviously. The second one is food and bioeconomy. The third one is energy. Then we also have transport, climate actions, Europe in a changing world. This also includes now, of course, something like migration and integration, and secure societies. if you're looking at this program, or if you're looking for research funding, no matter if you do it on national or European level, you can put on different classes to look for that. So you can either think, okay, let's have a look what calls, what topics are there, what do they fund, and do I fit somehow into in this funding landscape which is available. The second perspective you can have is, are there any topics available which are funding my specific project? So I have already a project in mind, and I look for funding. And the third perspective you can have, and I think this is really important for you at your point, if you really think about staying in science or in research, how can I find instruments which really support my career? So of course you know already, to have a good CV, to have really key performance indicators in your CV, of course, supports your career. And EU research funding, or getting EU research funding, can of course help you enormously to build your independent research career. I will today concentrate on the first and the last question, so because I don't know which projects you have in your mind, but I can give you some insights on which topics are available, which topics or areas are covered, and how you can find, or which instruments are available to help build your own career. So for the thematic areas, of course, we will concentrate on health, but maybe on a meta level, it's important to think about, okay, how can I find those topics? So where are they available? We all talked about the work program and the framework program, but where are the specific topics? I want to show you that. Then a quick look at how those topics look like, so how you can read and interpret them, how do you get the essence of what the EC wants? Just a quick look at that. Yeah. So the first question is how to find the topics. So we have already heard there is this participant portal. So the EC has created a portal where you can really find for funding opportunities. We will distribute the slides later, and I have inserted the link here, so you will get that. So under funding opportunities, you see this, it's not the nicest website of the world, but, but you can really find everything you need there. So you find here the funding opportunities tab, how to participate, projects and results. So you can also look at existing projects there. On experts, also getting an expert. You can enter your contact details there if you want yourself be an expert and evaluator to Horizon 2020 proposals, and you can get support there if you have any technical problems, for example. So now we are at the tab Funding Opportunities. Here you find all the calls, all the topics available under Horizon 2020, but also to about other funding schemes which are available, but yeah, as we already said, Horizon 2020 is the most important and biggest framework program or funding program. If you search for a topic there, you can you will find the topic health, as we have seen before, and the main focus areas, or the main the main focus on the EC regarding health are those three at the moment. That will change, of course, for Horizon Europe, but you will see that it's not that you will find a call which is which says, okay, we want to have a research proposal on this specific disease and this specific therapy for this disease. You will not find that. That's quite open, the calls are quite open, they cover a lot of different things, and they are really designed on a meta level. So what is the priority? And that one priority is, of course, a better health and care system in the EU, which is also, again, connected with economic growth and in a sustainable health system. So here you will find topics under the keyword personalized medicine, of course, innovative health and care industry, so again, the connection between research and industry. Infectious diseases and improving global health. This is, of course, some very urgent. If we think about infectious diseases, how they spread, and of course the EU, even if we do not have any epidemic diseases in the EU, of course it is an important topic for the EU to do research on that. Also, again, together or in connection with the so-called Sustainable Development Goals. Innovative health and care systems and the integration of care. And decoding the role of environment, including climate change, for health and well-being. So you also see that the challenges are quite interconnected. So those are the most, the headlines of the specific topics. And calls, specific calls in those areas might have the name mental health in the workplace, for example, or systems approaches for the discovery of combinatorial therapies for complex disorders. So still the disorders are not named, the therapies are not named, so it's quite open. You can apply for a lot of things under those topics. But of course it means also a quite big competition, right? So there are maybe cardiovascular diseases competing with mental health issues for the same call. Another one could be regenerative medicine, from new insights to new applications. The second big part or focus area in the thematic area of health is the digital transformation in health and care. So that's of course the digital agenda, and the digital union wants to implement all the technologies which are supported in all kinds of systems and areas, and of course also in the healthcare system and in the health system. So this does not only mean that we have digital hospitals, but also of course having digital technologies used in research and for maybe systematic changes in therapies or so on. So, I'm sorry. Under this topic, topics might have the name exploiting the full potential of in silico medicine research for personalized diagnostics and therapies in cloud-based environments. Or a large-scale implementation of digital innovation for health and care in an aging society. Again, it's quite open, but what you can see there is, of course, you cannot tackle or address this call on your own. You need partners with different expertise, with different background, with different also goals maybe within the project. So there are research partners who are motivated to do the research for research. There are other partners who are part of the project because they really want to exploit the results, go to market with it. So you see from the topics that this is really a diverse group which has to work on such kind of topics. And the third focus area is trusted digital solutions and cybersecurity in health and care. Of course, this is very important, that especially patient data or health relevant data, which is digitalized, which is available in a cloud, for example, that there is special safety and that there is done research on how to best protect those data. Okay, if you look for a topic, you will enter your keywords into the search mask and you will probably come to this topic, which is called Towards Risk-Based Screening Strategies for Non-Communicable Diseases. This is what you get first. That's the topic header online. So this doesn't look very informative, but you can already extract some information from this header. The first one is that it is part of Societal Challenge 1, of course, health, that it is part of the focus area better health and care, and that this is a call from for the year 2019. That's what the first red square tells us. The second red square tells us that it is a research and innovation action. That means that it's not only targeted towards industry, but also to research. So this is really where the research partners play a key role in the project. I will come to that later again. And the third information, which is quite important, is that it is a two-stage proposal procedure, so that you have a first short application, which is in health, I think, around 7 pages. And if you're evaluated in favor, then you will be invited to a second stage proposal, which is then really a huge proposal. So this is around, this is 70 pages for the main part. And again, some extra pages for presenting the partners, their skills, addressing ethical issues, addressing security issues. So such a proposal will have in the end about 100 to 120 pages. Yeah, this sounds enormous, and I think that this will take some years until you really will participate in really the proposal, in the proposal phase. But it's good to know how these things work, because maybe someday you will work in such a project, and then you have at least to read the whole application. And maybe be part of the management team as well. So those projects have a quite a complex structure. But it's worth it, because working on a proposal with different partners, with different perspectives, with different backgrounds is a really interesting endeavor. So after you have seen the header and have realized that you have to write 70 pages, you can go to the topic text. For each topic, the structure is quite the same. So the C describes the specific challenge. There you get background information. So what is the societal, the socio-economic, and also the scientific background? Why is this challenge important? Why did the EC or the program committee choose this topic to be open for projects? Here you will also find maybe some policy drivers, what we have already heard before. For example, the Sustainable Development Goals, digital single market, for example. Those are things which may play a role in a specific challenge and which have to be addressed, of course. So after that, you will read the scope of the topic. So really the specific goals which should be reached by the project. So again, it will not tell you you have to do research on this specific disease. But it will tell you, for example, here, proposals should develop new or refined targeted population-based screening interventions aiming at identifying populations or groups at high risk of developing disease. So that could be, of course, a lot of different disease, but this is the specific scope of the project or of the future project. This will also, in the scope, you maybe also will be told which disciplines have to be involved to tackle this specific challenge. You will maybe also read in which areas the results should be applied. So for which specific areas the results should be available, for example, care system or as a therapy, as a screening method, and so on. And you will also get some information about the size of the project. In the former framework programs, it was really an absolute budget, so budget limit, so up to 6 million euros, for example. In Horizon 2020, the budget is more flexible, so there is a range for those kind of projects. In this case, it's between 4 and 6 million euros. Because those topics are so openly defined, different projects might have different needs and, of course, budget needs as well. And now again, we are at the impact. So in this, in the last part, they tell you which kind of impact they expect. So this is something you have to address in your proposal. So which effects does your proposal or your planned project really have on specific domains and challenges and on society, on the patient, on the healthcare system, and so on. So this is really very important. The impact is, I would say, in each proposal, really, really important and much more important than it used to be in the former framework programs. And what we already also heard that in most of the calls or topics, we also have like a cross-cutting priorities. Those are overarching topics which are involved. We will come to that later, and we have already heard a little bit of it. And for this specific call, it is important to also address open science, which is more or less important for each topic. But it's also important to include socioeconomic science and humanities. So this is something which is really quite new, and as far as I know, it doesn't work that well. But as you maybe have seen, the calls are really targeted towards hard science and engineering, and of course the humanities and social sciences complained that they do not have any goals available. So the idea was that social science and economic science and humanities should be included somehow in the more hard science calls and topics. As already stated, it works not that well, but still it is a priority that the disciplines come together and work together on specific challenges, and especially for health, this might be really not too artificial, because of course you have ethical questions, you have to deal with patients, you maybe have to design your therapies according not only to scientific questions but also to the ability or the needs of the patient, where maybe social sciences and humanities can really help to achieve that goals. And another thing which is really important on EU level is gender and also sex. So for example, especially for health, of course, to address gender or also sex-specific differences or integration is really, really important, I think, in almost every call. Any questions so far? No? Not fallen asleep already? Okay. So, in the area of health, it's not that common that you are dealing with technology readiness levels, but still I think this is a concept you should at least already heard of. This is a vehicle for the EC to define on which state of technology readiness or application or applicability your research is already. And this is, I think this is originally taken from space science, so it's maybe not totally transferable to health or other sciences, but still it gives you an orientation on which level you are doing your research. And for such for some calls, it's really defined. So when you're applying for this and that call, you have to start with TRL 4, and in the end of the project, we expect TRL 6 or something like that. So it's maybe good that you have already heard it. So the first 4 levels are maybe really the part where science is still part of the game. So this is, of course, basic principles observed, technology concept formulated. TRL 3 is already experimental proof of concept. And TRL 4 is that the technology has already validated in lab. After that, I think it's really important to have an industry player in your team. TRL 5 is technology validated in a relevant environment. And I do not go through all of them, but in the end, we have TRL 9, which means that the actual system is proven in an operational environment, so that you can take it, put it on the market, no risks, no safety issues anymore. So then the rules of participation. This is now focused on the collaborative projects, but also already some information which is interesting for all types of funding instruments. So there are, for collaborative projects, as we have seen the topic before, this was a call for a collaborative project. We have first of all the research and innovation actions. These research and innovation actions mean that they are asking for projects that are tackling clearly defined challenges, which can lead to the development of new knowledge or new technology. So this is not, those are projects where you really can be part as a researcher to tackle the challenge. Here the expectation is not that you have a product in the end or an application in the end. There might be the expectation that there are specific guidelines, for example, and in the end, or at least a new that you push the door open to a new therapy, to a new whatever way of addressing specific challenges. But it's not that you really have to throw your thing on the market in the end. Still, it is, yeah?
Does then be most applicable to like the basic science?
Yeah, so in those projects, basic science can be a part. It's not that you can do only basic science. So you really, at least you have to include patient groups or, yeah, some kind of social players, societal stakeholders. So it's really rare that only research partners are involved in such a project. But it's those projects which can be led by a research partner, and where it's usual that the majority of the partners are research partners. Still, it is in some calls, even if there are research and innovation actions, it is important also to include industry or at least other stakeholders. The minimum for such collaborative projects are 3 legal entities, which are established in 3 different member states or associated countries. And the funding rate is 100% of the direct costs plus 25% flat rate for indirect costs. What that means is another maybe talk, but so it's a good funding rate. You do not have to co-fund the project. The second action is the innovation actions. Those are the actions which are really close to the market. So those are typically really led by industry partners, and research partners are part of the consortium, but they are not the leaders or the drivers there. So those activities are really aiming for prototyping already, testing, demonstrating, piloting, scaling up, which has already proven in lab, for new improved products or processes or also services. So this is really, basic science does not really have a place there. Regarding the partners and the countries, it's the same requirements as in the research and innovation actions. You need 3 legal entities established in at least 3 member states or associated countries. The funding rate is lower here, so it's 70% for industry partners, but still 100% for non-profit organizations, so for research partners, for example. This is yeah, this was really a long discussion, when I remember correctly, because industry is already, they do not have problems with money most of the time, but still they get a lot of funding here. We will see how it will be dealt with in the future framework program. Yes, of course.
Is there a reason why it's specifically a minimum of 3 legal entities and not 2?
No, but I think, no, the reason behind it is that those should be really European research initiatives. So 2 partners is a close collaboration between 2 partners. So this could be an institutional collaboration, long-standing cooperation, they work always together, so okay, again. 3 partners is really more a European collaboration, because you have at least 3 countries involved, and it's, that's a minimum. But in the area of health, according to my experience, the minimum is 5 or 6, so, and there are even really huge consortia with 20 partners or so. And this is, but it's a really good question, because this is something which is really important for each research proposal on EU level as well, that you can really show the European added value. So why is it a European project? Why is it not funded under the national funding agencies? Why should it be really funded on EU level? Why is it EU added value? And there's a third action type, which is called coordination and support action. This is not really a research project you're applying for when you apply for this action type, but more a network and coordination action or scheme. But it's often the preparation phase for large research collaborations. So, for example, the new flagship initiatives, which are analog to the Human Brain Project, they now apply for CSA, and later on they will be established as consortia, and there will be the proper research funding available. Here it's not always obligatory to have at least 3 partners from 3 different member states or associated countries. For some CSAs it's also okay to have just 1 partner or 2, and the funding rate is again 100%. The eligible countries, so of course the EU member states are eligible, and you have already heard me saying sometimes member states and or associated countries. So there are the EU member states, associated countries obviously, and there are also third countries, so countries which are neither associated to the framework program nor member states, which still are eligible for EU funding. The third countries, it's a huge list, so I did not put that on the slide, but for the third countries, just to have an orientation, for the associated countries, sorry, those are the countries which are associated with Horizon 2020 and which are eligible for the calls and which get funding. So you do not, we will send out the slides, so you don't have to write them down, just that you get the impression. One thing which is, I think, for your field really important or interesting is that there are special kinds of agreements between third countries, so countries outside of the EU or the associated countries, for specific topics. And for example, for the societal challenge health, or for topics with health focus, US partners are still eligible under Horizon 2020. So you can collaborate with them under Horizon 2020 and they will get funding from Horizon 2020. It's not for each third country partner, and it's not, and the US is not eligible for other calls. But for the health, they have, for the health program, they have a special agreement. Yeah.
Is that same rule going to apply to the UK once Brexit happens?
I don't know. I don't think so. I don't think that they will make it dependent on special focus areas or thematic areas. I don't think that will happen. I think they will find other solutions. But
so the answer is you guys don't really know?
Nobody knows. Nobody knows. Not even Miss May knows.
Probably, if you think about Switzerland, for example, there we have the example. In general, the countries fix an association to the whole framework program. That means to Horizon 2020, and not only to a special part of Horizon 2020. Sometimes this can be the starting point, as it had been for Switzerland, but we don't know at the moment how it will happen with the UK. But at the end, probably it's more really concentrated on Horizon 20, or Horizon Europe in general.
For these associated countries, is there like a list of conditions they have to meet to be considered associated countries? I mean, probably because, I mean, I don't want to sound like too negative or like an asshole, but some of these countries are not really like anywhere near Europe. Like, why are they counting towards like what are applicable for European funds? I don't understand that.
Yeah, they are associated. They have an agreement with the EU that they are associated.
Yeah, okay, but are there conditions that they have to meet in order to be associated?
No, those are no negotiations between the countries and the EC.
Okay.
Like for example, the EFTA countries, you can see them here. So if there are already existing collaborations, they could occur also for funding programs like Horizon 2020.
Yeah. Any other questions on the countries? No. Okay. So now maybe the most interesting part for you, career supporting measures. Those are more or less two funding schemes. On the one hand, the Marie Skłodowska Curie Actions, and on the other hand, the grants of the European Research Council. If you think about your career or your years after PhD, there are special funding instruments for specific career phases. So probably most of you already participated in the Erasmus program or Erasmus Plus program, so that's maybe your first step into EU funding. This is funding mobility, obviously, between or within Europe or beyond Europe as well. This is something you can do, of course, before you have your PhD. But it's not research funding, obviously, so nobody is, you do not have to hand in a report on your research after you did your Erasmus year. But when you did you have your PhD certificate in your pocket, you can really start to apply for EU funding. Those instruments are really individual fundings. So this is funding for you. That's not like 3 partners from different countries. It's really funding for the individual applicant, but together with a host with a so-called host institution. So you and your university apply for this grant. The first grant you can apply for are the Marie Skłodowska-Curie individual fellowships. So this starts from year 0 after PhD, so that's also available in the early postdoc phase. And in the end, there is no limit, so you can also, 10 years after PhD, you can apply for this funding. If you're already an established postdoc, or you're maybe already a junior professor somewhere, the right funding instrument might be the ERC starting grant for you. So this is I will come to that later in detail, but this grant is highly prestigious, is funding your independent research group. So this is something where you can really establish your research group with. And this, you are eligible for this grant between year 2 and year 7 after your PhD. After that, there is the ERC Consolidator grant, and some years after that, there is the ERC Advanced grant. So this is, of course, just schematic. It could be a little bit different as well, but years after PhD, corresponding to career stage, corresponding to individual funding scheme. And this is also something the EU or EC sees as the ideal European career, so that you have Erasmus Plus as a student, then you start with the Marie Curie individual fellowship. After that, you get your first ERC grant, then your second, and then your third. So you can already prepare for this ideal career. Because, of course, this is for excellent scientists and researchers in the EU. Now we will focus on the postdoc level, obviously. So the Marie Curie individual fellowships and the starting grants, the consolidator grants, I will skip that. For the Marie Curie individual fellowships, what are the goals behind? So even for individual funding, there are priorities and policy drivers behind. So the goal is to support the mobility of researchers within Europe and also beyond Europe, and to attract the best foreign researchers to work in the EU. Those are fellowships which are individually awarded. I've already said that. They are transnationals. I will tell you in a second what that means. For researchers of any nationality, but they have to be employed in a EU member state or associated country, not in a third country. The goal behind it is, again, something on the agenda of the EC to strengthen Europe's human capital base in research and innovation. Also connect this with the entrepreneurial spirit, and to attract the best trained researchers to the EU at an early career stage. And it also addresses the vision or priority of the EC that there should be really high quality, high standard of research innovation in Europe to contribute to Europe's competitiveness and growth again. What does it mean in practical terms? So who is eligible, what you can apply for? It's open for all projects, so you do not have to read too much policy papers when you're applying for that. It's really a bottom-up in all research fields. Your qualification has to be a PhD or at least 4 years of full-time research experience. The funding is 1 to 3 years, a little bit depending on the funding line. There are some different funding lines. I will come to that in a sec. The host institution has to be university or University of Applied Science or a research organization, or even a company if possible, located in an EU member state or associated country. And the fund living and mobility allowance, and also contribution to research costs and management and overhead. So you will they fund your position in the end, including travel costs and so on. There are two main funding lines in the field of individual fellowships. The first one is the European Fellowship, the second one the Global Fellowship. The individual fellowship is 1 to 2 years of funding. That's actually, you can decide on how long the funding period should be. I already said that, researchers of any nationality. There are 8 scientific evaluation panels or 3 separate multidisciplinary evaluation panels. There is one reintegration panel, which is aimed at researchers coming back to the EU, so researchers who have done their research outside of the EU or associated country for some years and would like to come back to Europe. There is also a career restart panel, so if you have a career break for any reason, like sickness or parental leave or whatever, you can apply for career restart, and for that they also fund up to 3 years. And there is a special panel which is called Society and Enterprise, which is open for people who are applying for doing the research with the company. And you can also have secondments there for up to 6 months. The second funding line is the Global Fellowship. Here you can get 2 or 3 years of funding. And this is only, the target group here is postdocs and postdocs only from member states or associated countries who go abroad and come back then. So you can go with that grant, you can go 2 years to the US and come back for 1 year to Germany, for example. The success rate is, that's always interesting. It's not, maybe it's not really encouraging, but it's interesting. For the European fellowships, it's around 15%. For the global fellowships, it's around 12%. This sounds really, really low. But I think that there are, or we know that there are huge differences in quality. So not every proposal which is submitted has really good quality. So don't be discouraged when you read those success rates. They have to be put into the right context. So now the really famous, prestigious European Research Council grants. The Marie Sklodowska-Curie individual fellowships, they are seen like the little brother of the ERC. So if you have already obtained one of those grants, you're really good prepared to apply for the ERC starting grant scheme. So that's really, I think, a major asset for your CV if you start with the Marie Curie individual fellowships. And then later on, maybe think about the European Research Council. So what is the scope or the goals of the European Research Council? They want to fund investigator-driven frontier research. This frontier research is a really special word, but it means that it's not too important if it's basic science or applied science or something in between or something beyond. It's important that it really goes on the frontiers of knowledge and that we can open new spaces in science and knowledge. This also is, of course, closely connected to the famous high risk, high gain approach. So those funding instruments are not designed to have your project, work package A will last from month 2 to month 3 and we will have those milestones. I will submit them in time to the EC. Of course you can define work packages, but it's okay if something is not working. I hope this is working, this thing, window above us. So it's, but it also, you have to argue that your research is risky, but if it works, it has a really high gain to it. Again, we have impact, but the impact should be impact for science and for knowledge. And for a specific field or even across disciplines. It is designed for excellent researchers and their teams. And again, host institutions are universities or universities of applied sciences, research institutes, etc., in a EU member state or associated country. Again, for the starting grant, so the first grant in the ERC funding scheme, the target group are obviously excellent young researchers which have obtained their PhD 2 to 7 years ago. The host institution, we already said that. You get really a lot of funding. You get 1.5 million euros for 5 years for your project, for your team. The budget is really quite flexible, so this is really a great opportunity to build your own research career. Again, it's open to all fields, it's bottom up. There are 3 major domains, so physical science and engineering, life science and social science and humanities. There are sub-panels where you have to choose which panel might be the most interesting or most suitable for you. But still it is bottom up. You do not have to think in any discipline lines. Yeah? You design your project bottom up. It's a 1-step application, submission, but a 2-step evaluation. So you submit your written proposal, which is not 70 pages, which is around 25 pages. And the second step is the evaluation of the full proposal together with an interview in Brussels in front of the evaluation panel. The evaluation criteria are the excellence of the PI, the excellence of the scientific project, and the, another EU slang jargon word, the groundbreaking potential or disruptive potential of the project idea. Here the success rate is quite similar to those for the Marie Curie fellowships. So now I have to hurry a little bit, I'm sorry. Cross-cutting topics. We have already heard a little bit of it. So we have already heard, open science is a big thing. We will talk a little bit about it, what's behind this word or concept. Another thing which is quite interesting and new and which is really encouraged a lot on EU level is called responsible research and innovation, and I think especially in your field, health or the interaction between health and ICT and so on, this is something which is really interesting for you as well. And some words about spreading excellence and widening participation, so how research can help to share information in the EU, strengthen specific countries, and so on. We have already heard the 3 O's by Commissioner Moedas. Those are the really famous priorities of Commissioner Moedas, which are open science, open innovation, and open to the world. Open innovation is maybe not that interesting for you. Open to the world simply means, or not simply, but behind that it means that, of course, the EU wants to be the leader when it comes to science, to economics, to whatever. But still there are challenges, there are topics which are of worldwide interest and worldwide challenges and problems, and we have to tackle them together. Also, international cooperation is not only minus, but also a big asset for research. What's behind, just short thought behind those 3 O's is the need or the vision of Commissioner Moedas to have really a system change towards sharing and using all available knowledge in research and innovation. That's the basic idea behind it.
Do you have like a document or maybe like a manifesto for this kind of
Yeah, there is. There is. I will put the link on the slide. Yeah, there is an online PDF which addresses those 3 O's. I think it was published 2016 or something. So yeah, that's the basic idea behind it. That science and also innovation, that those should not be closed shops or clubs. But that they really open up, and that knowledge which is generated in research is shared within the community without barriers, and not only within the research community, but also with society. So of course the traditional, for example, a traditional publishing system, it's really closed to society. No civilian can access research data, research results without having access to a university library, for example. So this is really the idea behind it. So the EU funds research with taxpayers' money, so the taxpayers should get access to that results, for example. So, yeah?
I mean, it was also said in the other talk that basically if you want to get new funds, you need to publish open access, right? But
no, the other way around. If you get funds, you have to publish it. Yeah. Yeah.
But most of the most high impact journals, they are still closed access, right? So does that mean that as a researcher, I have to make a choice in my career, do I want to publish high impact or do I want to get funding? I mean, that's also not what you know.
No, that's a lot of researchers have this misconception, but okay, this would be really another workshop session on its own. But basically, it's that if you publish in a high impact journal, you can publish it still open access after embargo time, maybe. So there are embargo times of 3, 6, 12 months. So you have your contract with the publishing company that tell you, okay, you're not allowed to publish your paper publicly available for 1 year, yeah. But after that, you can do that. So and then it is open access.
So for example, preprint servers like archive, bioarchive, they
exactly.
would also count as
yeah,
okay,
exactly. So there are different ways. There is this golden path and this green way to open access. But the idea behind it is, that it is publicly available. And if it's available, 6 months after you have published it in your high impact journal, that's okay for the EU. Open science, again, there are some policy ideas behind that and concepts. Of course, it is only possible because we have really a strong infrastructure and digital technologies, and big data and globalization. So this, of course, has a strong interconnection with the digital European research area, and with the free circulation of knowledge and technologies. It is also not only addresses things like open access, but it is also like a dynamic concept covering the whole research cycle and its stakeholders. That means each research step should be available to everybody who is interested. And one step further, on a specific point, it may be useful to include other stakeholders in your research, such as citizen science or co-designing, if you really design together with your target group the specific application. Those are concepts which are also part of open science, so open up science in every possible way. The main activities behind open science are, of course, open access, but also open research data. We addressed that briefly before, that you do not only share the results of your research, but also the basis of your results, so your data. This is also supported by a European initiative, which is called European Open Science Cloud, which is also funded by the EU to provide the infrastructure for open science and open data. And as already said, it also includes citizen science. Some words about responsible research and innovation. So this is also, of course, again closely connected to the open access and open science concept and thoughts. You will see there are some keywords which you already have heard today. The idea behind responsible research and innovation is that research and innovation has to take into account the impact and the potential effects on environment and society. So this was really neglected for a long time. Researchers were doing their cool research stuff, not so much in health, but in other areas. And it was not really thought about what will be the impact on society if this technology will be really used on everyday basis, for example. And this is something that you really want to avoid. So responsible research and innovation is the alignment of research outcomes with the values of society. That sounds really like greasy, but that's the concept behind it. And the keywords or the sub-areas, oh my God. Yeah, we will stop soon. No worry. The keywords or sub-areas behind are public engagement on different levels, so not only citizen science, but also informing the public on your research activities, on new developments, on new results. So when it comes to climate change, this is working better than some years ago, but this is something where really the public is engaged and is, at least informed about the research results a lot. Open access, we have heard that. Gender, of course. Ethics, that's for you, it's, yeah?
Under public, do you count politicians?
Yes. Yeah, of course. Ethics, of course, especially in your field, this is really important, but also in other fields, you maybe have heard the discussion on, okay, who is responsible if an autonomous car crashes? So that's an ethic and legal issue, and such things have to be discussed accompanying the development of the technologies. And another thing is science education, which again, of course, closely connects to the Marie Skłodowska-Curie, I will never say it right, I think. Actions that, of course, science education is something really important for scientists, but also for the public. The citizens, interested people in the end, are able to deal with scientific results. But on the other hand, it's also important that scientists and researchers are educated to communicate their results to the public. So this is a really important focus of the EU as well, that the interaction between science and public gets deeper, and that scientists are really trained in doing so. Yeah.
Who's actually responsible? I mean, when it comes to ERC projects, who's responsible for journalistic accuracy? So, you know, scientific accuracy in journalism. Because I see a lot of reporting that is complete BS, that is not necessarily true to science. So just whenever we're talking about journalism, public outreach and stuff, people blogging content that's supposed to be scientific, but is actually not correct.
Yeah.
Or misleading for the public. Who's in charge of like monitoring these things?
No,
Is it any kind of sort, yeah?
Obviously nobody. So journalists, of course, they can publish whatever they want. There is no quality control, but that's why it is so much important that scientists are better trained in communicating their results, because they have the knowledge and they need the skills to communicate the correct results.
Yeah, but then there's scientists and then there's journalism, which is, you know, it works on creating flashy results and headlines that are not necessarily true.
Yeah, of course, fake news all over the social media. Yeah, no, there is of course no instance. So that's exactly why the EU wants to encourage people who have the knowledge and have the basic basis, the scientific basis, to transport the results and not going via some channels which maybe misinterpret the results.
I agree, I just don't think it's enough. I think we need some sort of chat, like.
Yeah, that's of course a discussion. There is a lot going on in Brussels in this area as well. There are really stakeholders who are taking care of this. I think there is an association which is called Facts Matter, who are really trying to bring politics, scientists and public together and discuss about facts and not feelings. But there are no control agencies for that. So last topic, spreading excellence and widening participation. I will go through that quickly. So those are instruments designed to assist low-performing member states and associate countries to improve their research and innovation system and policies. You will here see the regions or the countries which are addressed by spreading excellence and widening participation, which are especially supported by the EEC. Those are more or less the EU 13, so the new member states, including also Portugal and Luxembourg, and some associated countries. The goal is to increase the participation of those countries in EU funding schemes and instruments, and also to do really science education, to build up their science systems. That they, because of course, if you strengthen science and innovation systems, ecosystems, you also strengthen the economic systems in those countries. There are special funding instruments for that, but I think I will skip that. But what's interesting is that there are special widening fellowships. So there are the individual fellowships on a Marie Curie funding scheme. And if you apply with a host institution in one of those countries, you have extra chances to get the grant. That's how the EU wants to ensure that really such countries also hosts really talented researchers, and not only the cool countries or the already established countries. So one of the most important things, last but not least, where do you get support for all those things? Of course, if you're someday trying to apply for collaborative projects, you have to find partners. If you're applying for a Marie Curie individual fellowship or a ERC grant, you need to find a host institution. And for any other things, you need, of course, some kind of support. First of all, how to find a host institution for maybe an individual fellowship. We have already talked about it. Use your own network. You have a great network via the Human Brain Project. I'm sure that there are a lot of professors who might offer you be there to be your host when you're applying for funding. But also beyond the Human Brain Project, your institution you're working at the moment, they might have institutional long-term cooperations with other institutions which might be useful. And of course personal contacts on occasions like this or conferences. That's nothing new for you, of course, but maybe it's good to remind you of that you are already in a quite vital network. But there are also service centers or national contact points. For example, in Germany, there is the COWI, Kooperationsstelle EU der Wissenschaftsorganisationen, or a European Liaison Office of the German Research Organizations. They have really on their website host institution offers. So you can look, have a look there if maybe there is a host institution which is interesting for you, which is currently offering to be a host institution. For finding partners, we have already heard that briefly again. In the participant portal which I showed you, you can also look for partners. You can go to different associations. We have already heard about EATU. There are other associations, leagues, whatever, interest groups on EU level. Maybe you check where your institution is partner in, where you can use the network. And of course, I'm quite sure that you have institutional support, so people like us at your institution. Maybe quick overview of the service we offer, and I'm quite sure that you will have similar offices at your institution. We are offering strategic consultation support concerning conceptual planning on initiatives on specific projects. We also organize events, workshops for specific funding lines or target groups. We support for specific proposals or initiatives, and we are also like a relaying point for contacts on EU level or national level. We also have colleagues at the Forschungszentrum Jülich who are doing the administrative and budget stuff, so we are not concerned with that, and you should not be too concerned with that as well. So I'm quite sure that you have support with that as well, how to calculate your budget, how to fill in the administrative forms for your application and so on. For us especially, but I'm quite sure, or it's probably that you have something like that as well. We are, because we are part of the Helmholtz Association, we have already said that. We have the convenient situation that we also have really a liaison office in Brussels. But there are also national networks and contact points. In Germany it's called NKS, Nationale Kontaktstelle zum EU-Programm Horizont 2020. But in your country there should be something like that as well. So I just had a quick look at the participant list, so I hope I have covered each country. If not, you can look it up. I have put a link on there where you can also, on the participant portal, find your national contact points. It's quite different from country to country because in some countries, like in Germany or in France, the national contact points for different areas are not grouped into one institution, but are scattered in different institutions. But for others, in Austria, for example, they are really all service provisions are based in one institution. So I'm pretty sure you will have a contact point in your country, and really do not hesitate to contact them. They are really dedicated service points for your questions when you, if you are thinking of applying for EU funding. So that was it. Thank you very much for not calling us.